My lab has been working on RSACs for the last 10 years or so. We concentrate now very much on understanding the disease at the cellular level in the context of how can we modify the cellular changes by adding drugs, potential drugs, to our preparations, including how could we use drugs in their animal models. We presented in the last symposium a new model, a model where the protein is still present, though mutated. We call it a knock-in mouse model. We think it certainly reproduces the disease, and it may have a milder phenotype. It will be useful to understand better the disease and how some minor changes in the mutated protein have an impact and lead to the condition. We've also shown that, in fact, using fibroblasts from patients, we were able to screen close to 20,000 molecules, some of which have promise as drugs, and we're continuing to work on those with the close collaboration of the Michel Bouvier-Iric group at l'Université de Montréal. In particular, my group is centered on the cytoskeletal abnormalities in RSACs. We were the first to show that the cytoskeleton, which are the inner skeleton of neurons, is abnormal in patients' models, including even skin cells, and that this probably leads to the disease by not allowing proper architecture, but also proper migration of mitochondria and other organelles that are needed for function in very long neurons, or neurons with very elaborate dendritic trees like the Purkinje cells. So we've made quite a bit of progress on that, including the identification of a new drug that influences cytoskeletal architecture. And we think that this would lead to potential better understanding of what is dysfunctional in RSACs. In pharmaceutical terms, that may mean finding targets for the new drug we've identified, but others to come. Lastly, I've collaborated with the very dynamic group of Cynthia Gagnon in Saguenay, who has been able in the last few years to, thanks to the participation of Saguenay RSACs patients and now European patients, to develop outcome measure validated scales that will allow us to treat patients in a clinical trial. As you can imagine, this is very important to accelerate bringing a medication to patients. So the very large multi-collaboration program on RSACs internationally could not have been possible without the constant support and motivation provided by the Ataxia Charlevoix Saguenay Foundation.